Hello and welcome back. Dr. Mulholland in New York. We are doing a duo light, double wavelength, fusion light 755 810 treatment on the lower leg. The advantages of the duo technology from InMode, the fusion technologies, you get the best two wavelengths for skin type, 755 810 for skin types 1, 2, 3, 810, 1064 for a darker 4, 5, and 6 in the same pulse. Boom, 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 boom. You get broader coverage for different depths of different bulbs because our goal is to kill the bulbs that make the shaft and in the bulge for the primordial cells that will make a new bulb between the next telogen anagen cycle if we don't kill both levels. Hence, two wavelength hair removal fused into the same pulse. Boom, 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 boom. Gives the best permanent reduction ever submitted to the FDA. The techniques and strategies pretty straightforward. Tilt down. Let's look at the lower leg here. And typically, the patient has to have some dark hair, should not have undergone depilation recently. You need to target, should commit to no sun exposure, and should not be tanned currently. And you want to see a stubble and then shave to a stubble. And then you want to apply the parameters and tactics and strategies that make sense. So typically, we'll imagine that she has a dark hair shaft, she's shaved to a stubble, and she understands no sun exposure after the treatment, and we divide our lower leg. I use typically a white eyebrow liner into zones. And so we come right down the pretibial area. We divide into 4 quadrants, front and back. And we're going to do a glide and a slide method. We're going to use low energy, 2 wavelength, super fast pulse duration, 5 pulses per second, to cause selective photothermolysis very quickly on the low-lying fruit of opportunity. Then we come back over the same skin with higher energy, 20 to 30 joules per centimeter squared, but slower to get selective photothermolysis on more difficult bulbs and shafts. So super fast, then very methodical. Typically, you should be able to treat the lower leg, upper chest, entire back, lower leg, and upper chest in about 12 minutes. An entire leg in about 16 to 18 minutes per side. And so let's take a look at how that works. We've shaved to the stubble. Now, all patients are skin type 4, 5, and 6. I personally do a test spot and bring them back. I do a test spot and bring them back. I look for hyperpigmentation. For all skin types 1, 2, 3 in my jurisdiction, I go right to treatment. And that's just an insurance and medical legal liability risk in my market. And so we use nothing but ultrasound gel. You don't need cryogen. You don't need expensive Zimmer cooler. This has a pre-parallel and post-cooling that makes this very, very comfortable. So give me enough to do the whole area. Put that back on here. We'll come back to our machine. So come off me now, Carlos, back to the machine. This is our Optimus Max. We've looked at all the different revenue opportunities on this. We had the Forma Plus plugged in. You can plug in 2 RF opportunities and 1 optical technology at any given time. We're going to go to the Dialase 755 810, which tells me it's plugged in already. Up comes the treatment screen. And we're going to put some parameters and tactics that allow us to do first the high speed, 5 pulses per second, low energy. Usually that's going to be in that 4 to 6 joule range. And you've got a pre-parallel and post-cooling. So as you're sliding, you're pre-cooling the epidermal surface, cooling during the treatment, and cooling after. So that same area of skin gets pre-cooled, parallel cooled, and post-cooled when you're doing the slide and glide. And so we are going to do 5 joules per centimeter squared, strong cooling, very short high speed, and we're going to do in the glide mode, and we're doing a very short pulse width. And so we're going to turn that on. Eye protection for the patient, eye protection for the treating physician. So let's put eye protection on her.